Good evening, Professor. This is my personal timetable. So, in this week, I have to continue the case first. I already mentioned there, I'm working in the three different type of cases for the checking our D5 chip. So, the first case is I already explained that once, like we using piranha cleaning and then washing with ethanol. So then also check the bare one results with the using impedance analyzer, and then we use graphene oxide is your immobilization via spin coating, that is 1300 rpm, and then put on hot plate for annealing at 100 degrees Celsius, and then afterwards waiting for the 2 hours, then we measure the capacitance via impedance analyzer and then use EDCNHS drop casting method on the surface and then put incubator. And as per the last meeting with the easy system company, so they suggested like to wash after like incubator. So I use that method for the washing and to washing the washing the 25 chip. So the first 12 chip I wash with the ethanol and the rest of the chip I wash with the DI water. So these are the results that I have mentioned here. So like these are the different kind of chips, like 25 chips we have, and then we put the bare one, it's same value. And afterwards if it's nanofarad, so the value is like graphene oxide of nanofarad and then EDCNHS and then washing. So at each washing we found that the value is more higher than the graphene oxide. It means the after washing we found that EDC NHS itself binding with the graphene oxide on the surface. So it does not peel out, like take out the surface of EDC from the graphene oxide surface. So it means like the value is having itself having EDC NHS. So I'll explain in the form of graph as well. So this is the case one. We're using piranha cleaning and then washing and then check capacitance of that. So then put on the hot plate. So if you see here, I just only mentioned 21 chip because the last 4 chip is not working. I already mentioned here the yellow one is the 15th number chip, 21 and 22 and 25th chip is not working and not responding well, so I just exclude out from the main graph. So I just only use 21 chip, and it's all this orange line seems the bare one. It's like value is same of all chip, and this blue color graph shows the graphene oxide. So the constant value, there is no as such one or three chip are getting higher peak, like higher value than the other one, but the other things, like if I consider the constant value is coming in this stage. And if I go across the after EDC NHS, so I found that the EDC NHS is having the more value than the graphene oxide, is from pico to nanofarad. So I just mention here the nanofarad values. So the blue shows the graphene oxide and the gray shows the EDCNHS. So this values I already mentioned in the meeting, last week meeting. So this scale represents the EDC value, and this scale represents the EDC graphene value, and this scale represents the EDCNHS value. So we got the nanofarad value as you have seen here in this graph. And afterwards, after the washing, as I already mentioned, the washing of 225 chips, one from 1 to 12 chips with ethanol and 13 to 25 chips with DI water. So as per the washing result, so I found that the value become positive. Why I'm saying the positive in the case of ethanol? Because the value is more constant in this case, and the value is not less than the graphene oxide value. So due to having the EDC and HS is on the chip after washing, so the washing technique seems like the uh, method to activate the surface, as well as the EDC does not remove from the surface after washing. That's why we got the this value is shows the after washing. It's because this value is above from the graphene oxide. The graphene oxide is having this much value, and we got the higher results than the graphene oxide. It means EDC is present on the surface. So considering these results, we have to move the second case. Like um, second case, we use just to mix together and then we use. So in this week, I have to prepare and I'm working on it, and hopefully I will deliver of case 2 results in this week and present it to you via PPT. And case 3 also, like APTS, graphene oxide, and EDC and HS. In this month, I have to finish this all the cases and deliver to you the results. And any case is getting well, so we move forward to the antibody and antigen. And this is the main uh, fast understanding process of each cases. So this process we followed, and once in any case is finalized, so we move forward to the deal with the antibody and antigen further. Via using different kind of antibody, like we have the PSA, we have the corona, we have the Alzheimer disease antibody and antigen. So in that case, we just move on and let's prepare the um, research plan accordingly. Thank you, sir.